Throughout this journey, though, we have always sought to keep Australians as informed as we possibly can. I can recall standing in this room a year ago, taking you all through many different issues as a result of the matters being worked through by our medical advice experts who have informed us all the way through this past year and more. Tonight we have received advice from ATAGI in the last 15 minutes, and we thought it was important that we came and briefed you on that this evening, so it was available immediately to Australians. The key principle of our management of the COVID-19 pandemic has been always to base our decisions on the expert medical advice. It has not been our practice to jump at shadows. It has not been our practice to take unnecessary precautions. We've been taking the necessary precautions based on the best possible medical advice. We've always taken the time to ensure we get that advice, consider it carefully, and make decisions in the best instance of Australians. And those best interests principally have to address the health of Australians. This is why we are in the position we are in today, and so many other countries would want to be exactly where Australia is today. And it means that when setbacks occur, then we can still go about our lives here in Australia, perhaps not as much as we may have before when COVID wasn't in this country, but even now to say it's in this country would be an overstatement. We have no community transmission currently being reported around Australia, and where outbreaks do occur as a result of arrivals into Australia, we've demonstrated a great capacity to be able to deal with that in a very effective way. The Australian Technical Advisory Group on Immunisation, known as ATAGI, has met to consider the medical evidence regarding unforeseen but yet rare and serious side effects mostly associated with younger people from the AstraZeneca vaccine. ATAGI has reviewed that matter, drawing on the international advice and data, and provided recommendations to government, which the Health Minister and I have this evening accepted. That recommends that an advisory be provided for administration of the AstraZeneca vaccine for persons under the age of 50, and I'll ask the Chief Medical Officer to speak to that in just a moment's time. We expect that this will require some changes to the arrangements we have as part of the vaccination rollout. We discussed that this morning at my media conference earlier today, that could be possible, and this includes when we might expect first doses ultimately to be able to be offered to all Australians. As always, we will encourage Australians to seek out the advice of their own doctor in relation to these issues. Australians make choices about their own health, and the best people to advise them on those decisions is their own GP, and we would encourage them to do just that. So with that, I might ask the Chief Medical Officer to speak to the recommendations we've received from ATAGI this evening. I'll then ask Professor Murphy to speak on the issues that then relate to the vaccination rollout, and then I'll ask the Health Minister to make some closing comments, and then we'll take questions on these issues tonight. I'm not proposing that we have a broader press conference on other matters tonight. I'm sure you will understand. We had one of those this morning, and I'll be standing up after the National Cabinet tomorrow, so there'll be ample opportunity at that time. Paul.
Thanks, PM. So, as the Prime Minister has mentioned, we've received advice from the ATAGI group this evening. So, this is a group of experts on vaccines, on epidemiology related to vaccines, on vaccination programs, and really they're an appointed committee to do exactly what they've provided tonight, to provide advice to government, specifically to Minister Hunt, so that those decisions of government can be advised by that best medical advice. I was at their meeting today, which went for several hours. That was the second one in 2 days, where they were considering specifically the issues that have been raised and people are aware of through last night and over the last week, particularly in Europe and the UK. Several members of that ATAGI group, as well as the Therapeutic Goods Administration, have dialed into those meetings, and so they had very up-to-date information on this issue of these particularly rare but serious blood clots that have been associated now with the AstraZeneca vaccine. So they took into account and really balanced the risk and benefit of taking the decisions they took today, which is related to their advice given to government this evening. And they took definitely note what was decided in other countries, which has been variable in relation to these matters, and put that into an Australian context, not only as we are now in terms of the epidemiology of the disease in Australia up to this point, but also looking into the future about what might happen if there are outbreaks of COVID-19 in Australia. So just to reiterate, this is a very rare event. At the moment, it seems to be around 4 to 6 per million doses of vaccine. It's only been found in the first dose of the AstraZeneca vaccine, usually within 4 to 10 days after that vaccine. But it is serious and it can cause up to a 25% death rate when it occurs. So that was the background, and so the ATAGI recommendations are the following. At the current time, the use of the Pfizer vaccine is preferred over the AstraZeneca vaccine in adults aged less than 50 years who have not already received a first dose of AstraZeneca vaccine. This is based both on the increased risk of complications from COVID-19 with increasing age and thus increased benefit of the vaccination, and the potentially lower but not zero risk of this rare event with increasing age. The second recommendation is that immunisation providers should only give a first dose of AstraZeneca COVID-19 vaccine to adults under 50 years of age where benefit clearly outweighs the risk for that individual's circumstances. The third recommendation is people that have had their first dose of the COVID-19 AstraZeneca without any serious adverse events can safely be given their second dose. This includes adults under the age of 50 and people who have had blood clots associated with low platelet levels after their first dose of COVID-19 AstraZeneca should not be given the second dose. So that's the all but one person that we've had so far in Australia are in that category. People that have had their first dose should safely have their second dose. The final recommendation is that the Department of Health further develop and refine resources for informed consent that clearly convey the benefits and the risks of the AstraZeneca vaccine for both immunisation providers and consumers of all ages. And that is underway, that work, and that will be provided overnight and into the morning.